ਅਲਬਰਟਾ ਸਰਕਾਰ ਵੱਲੋਂ ਇੱਕ ਤਾਜ਼ਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਜਿਸ ਦੇ ਵਿੱਚ ਜਿਹੜੇ ਕਿ ਨਸ਼ਾ ਕਰਨ ਦੇ ਆਦੀ ਹੋ ਚੁੱਕੇ ਨੇ ਉਹਨਾਂ ਨੂੰ ਨਸ਼ੇ ਤੋਂ ਹਟਾਉਣ ਦੇ ਵਾਸਤੇ ਜਿਹੜੇ ਉਪਰਾਲੇ ਕੀਤੇ ਜਾ ਰਹੇ ਨੇ ਉਸ ਦੇ ਵਿੱਚ ਇੱਕ ਹੋਰ ਪ੍ਰੋਗਰਾਮ ਜੋੜਿਆ ਗਿਆ ਜੋ ਅਲਬਰਟਾ ਦੀਆਂ ਜੇਲ੍ਹਾਂ ਲਈ ਵੀ ਲਾਗੂ ਹੋਵੇਗਾ। ਅਲਬਰਟਾ ਸਰਕਾਰ ਵੱਲੋਂ 1.4 ਮਿਲੀਅਨ ਡਾਲਰ ਹੋਰ ਨਿਵੇਸ਼ ਕੀਤਾ ਜਾਵੇਗਾ ਜੋ ਕਿ ਵਰਚੁਅਲ ਓਪੀਓਇਡ ਡਿਪੈਂਡੈਂਸੀ ਪ੍ਰੋਗਰਾਮ ਦਾ ਹਿੱਸਾ ਹੈ। VOD ਪ੍ਰੋਗਰਾਮ ਲਈ ਕੁੱਲ ਫੰਡਿੰਗ 6.4 ਮਿਲੀਅਨ ਡਾਲਰ ਸਾਲਾਨਾ ਹੋਵੇਗੀ। ਜੇਲ੍ਹਾਂ ਦੇ ਵਿੱਚ ਸਬਲੋਕੇਡ ਇੰਜੈਕਸ਼ਨ ਦੇ ਬਾਰੇ ਵੀ ਐਲਾਨ ਕੀਤਾ ਗਿਆ।
The addiction crisis continues to have a deep and a lasting impact in all of our communities. This is concerning and is not in any way unique to Alberta. It is important now more than ever that we remain committed to expanding access to treatments for as many people as possible. That is exactly what we're doing. Just recently, we have made significant advancements in our treatment capacity, and we've been hard at work eliminating barriers to a range of services. 2 years ago, we announced that we would be funding an additional 4,000 treatment spaces. 2 years ahead of schedule, we've doubled that commitment and funded over 8,000 additional annual treatment spaces. This means that over 8,000 more Albertans every year can access residential detox, treatment, and recovery services. These spaces have no more user fees, completely eliminating financial barriers to treatment. Last week, we expanded the virtual opioid dependency program and began fully covering the cost of Sublocade for Albertans. Sublocade lasts in a person's system for 30 days and providing stabilization and reducing cravings and significantly enhancing protection against overdose. This move has been described as a game changer. Advancement in addiction medicine and is available to any Albertan regardless of their circumstances, same day, no matter where you live. You can access this life-saving medication by calling the virtual opioid dependency program, and we're not doing this alone. This government and our partners such as police, EMS, fire, and nonprofits working together with a common goal to give Albertans the opportunity to access treatment and enter recovery. To anyone out there who is struggling with addiction, know that treatment works and recovery is possible. We have also been expanding services that reach the 70% of Albertans who are dying at home. If you're using drugs at home, you can download and use the Digital Overdose Response System or the DOORS app. It's free, it's secure, it's anonymous, and it could save your life by dispatching a medical response if you overdose. Anyone in Alberta can access opioid addiction treatment on demand through the virtual opioid dependency program. There's no wait list, and people are usually able to start treatment on the same day when they call. All of these initiatives are about building a comprehensive recovery-oriented system of care for Albertans, a system of care that is built on the principle that no one should be left without hope for recovery. A system of care that treats addiction as a healthcare issue and makes recovery available at every point in the system. Everywhere someone turns, recovery should be available to them and accessible to them in this system. This brings me to today's announcement. Our government remains committed to ensuring that communities are safe, that people are held accountable for their actions, but we are treating addiction as a healthcare issue at the same time. Today, we're announcing the first of its kind in Canada program. Starting today, people who are arrested and brought to municipal jails will be able to immediately start opioid addiction treatment while in custody, regardless of their charges. Through a partnership between local law enforcement and a $1.4 million per year expansion of the virtual opioid dependency program, detainees will have immediate access to evidence-based medications. This includes the gold standard opioid treatment medication Suboxone and the newly funded injectable version Sublocade. To seriously tackle addiction, we are building a comprehensive system that includes the criminal justice system, the healthcare system, and civil society organizations. Today's announcement is about bringing these systems together to connect Albertans with proven treatments that we know work. This is the first of its kind in Canada, but it's not new to the world. When Portugal faced their addiction crisis head-on, the community decided to put police at the center of the process. We cannot simply remove our law enforcement officers from the equation. A comprehensive system of care can and must involve our law enforcement officers in the solution. Police officers are not an arm of the state, but they are an extension of the community. Overall, the message remains the same. Treatment works and recovery is possible.